Hi, today we're going to perform the assessing of thorax and lungs. This assessment includes the anterior and posterior thorax of the patient. There are different techniques that will be performed, namely inspection, palpation, percussion, and auscultation. The equipments that will be used are stethoscope, skin marker, and tape measure in centimeters. Now, let's proceed to the patient. Hi, good afternoon sir. I'm Derrold Depona, and I will be your nurse in assessment of your thorax and lungs. May I check your name, sir?
My name is Josh Parino.
Okay, Mr. Aquino. This assessment is necessary for it to describe the condition and to detect irregularities and disorders of your thorax and lungs. Findings will be useful for future medical assessment and medications. There are different procedures that will be performed. First is the inspection of your thorax by observing the shape and symmetry of your chest. Next is the palpation, using my palms to check for some irregularities. Then the percussion by tapping using my fingers to your chest. Last is the auscultation by using a stethoscope to observe the sound of your breathing. I'm hoping for your full cooperation by performing the instructions that I will say for this assessment. Are you ready, sir?
Yes.
Okay, let's proceed. Before we start the assessment of the thorax and lungs, it is necessary to perform proper hand hygiene to avoid transferring of microorganisms to your patient. We should provide the client's privacy by closing the curtains and by closing the doors. Now, I will ask some questions about your family history. Sir, do you have any illness such as cancer, heart problems, or respiratory problems?
Yes. My family have a history of heart problems.
Sir, do you have any allergies? Do you have tuberculosis?
No, don't have.
Sir, what is your lifestyle? Do you smoke or drink alcohol?
I don't smoke, but I do drink alcohol.
Do you have any medication being taken?
Yes, I do vitamins.
Sir, do you have any current problems such as swelling or coughing, wheezing, or any pain in your body?
None.
This data can be useful for your future medical assessment and for diagnosis. Let's proceed to the first assessment, which is the inspecting of the shape and symmetry of your thorax, from posterior to lateral views. Then compare the anterior-posterior diameter to your transverse diameter. Sir, can you please turn 360 degrees slowly? As we observed, the anterior-posterior to transverse diameter is in ratio of 1:2, which means that the patient's thorax is symmetric. The findings in this procedure may contribute to detect the irregularities in patient's thorax. Now, let's see the spinal alignment of the patient to detect some deformities and observe the cervical, thoracic, and lumbar curvatures. Sir, can you please turn around? Now, sir, can you please turn to your left? The result is that the patient's spine is vertically aligned, and the three normal curvatures are in good posture. Now, sir, can you please bend forward at your wrist? Okay, sir. The spinal column is straight. Right and left shoulders and the hips are at the same height. Results from this procedure can detect if there are any abnormalities such as scoliosis. Now, let's proceed to the palpation of the posterior thorax. Sir, may I ask if you have any back pain or your hard to breathe? Okay. Sir, please turn around. Let's start the palpation of the spinal processes for tenderness and deviation. Now, let's palpate the sacroiliac joints. Next, palpate the paraspinal muscles. Okay, sir. The result is that the skin are intact. The posterior thorax has uniform temperature, and there are no tenderness found in the area. The result tells if there are any injuries. Now, let's palpate the patient's thorax for respiratory excursion. Sir, can you please turn around? Sir, please take a deep breath for several times. Okay, sir. We observe that the expansion of the thorax is full and symmetric. Also, my hands move apart with equal distance as the patient takes breath. The result can detect if there are any problems to the lungs of the patient. Now, let's proceed to the palpation of the tactile Prmsu. Sir, can you please turn around? Sir, can you please recite the word blue moon as I palpate through your posterior thorax?
Blue moon. 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 Blue moon.
Thank you, sir. The result is that the symmetry of the vocal Prmsu is bilateral. Also, the Prmsu is mostly heard at the apex of the lungs. This procedure will tell us if there are any abnormalities to the patient's lungs. Now, let's proceed to the percussion of the posterior thorax. Sir, can you please turn around? Sir, can you please put your arms across your chest and slightly bend forward? This procedure can detect abnormalities based on the sound produced through percussion. It includes resonant, dullness, stony dullness, and hyperresonant. Thank you, sir. The result is that the sound in every percussion note is resonant, except to the percussion note over the scapula. The sound of the percussion note in the diaphragm is at low resonant, which is normal. This procedure can tell us if there are any abnormalities to the lungs tissue. Now, let's proceed to the percussion of the diaphragm excursion. Sir, can you please take deep breath as I percuss through your posterior thorax? Percuss each intercostal spaces by the scapular line and listen to the resonance. If the resonance ends, it tells us that it is the base of the lungs. Mark the area, then continue to percuss downward. In this area, the sound is dull. If the dullness ends, it indicates the position of the diaphragm. Mark the area to be measured. The result is that the space between the base of the lungs and the diaphragm is 5 cm, which is normal. Results can indicate if there are any problems in the contraction of the diaphragm. Now, let's proceed to the auscultation of the posterior thorax. Sir, can you please take slow deep breath using your mouth as I auscultate your back? Thank you, sir. The result is that the sound of breathing of the patient is vesicular and bronchovesicular sounds, which are the normal sound of breathing. This procedure will tell us if there are any problems to the lungs of patient. Now, let's proceed to the inspection of the breathing pattern of the patient. Sir, can you please take breath for several times from your nose? The result is that the breathing pattern of the patient is quiet, rhythmic, and non-troubled in breathing. This procedure can tell us if there are any problems or respiratory diseases such as pneumonia. Now, let's observe the costal angle of the patient. The result is that the costal angle of the patient is less than 90 degrees, which is normal. And also, the angle which the ribs enter the spine is approximately 45 degrees, which is also normal. The result tells us if there are any deformities or abnormalities on the ribs of the patient. Let's proceed to the palpation of the anterior thorax. The result is that the skin are intact. The anterior thorax has uniform temperature, and there are no tenderness found in the area. Findings can tell if there are any injuries or deformities in the patient's rib. Now, let's proceed to the palpation of the anterior thorax for respiratory expression. Sir, can you please take deep breath as I palpate through your thorax? We observe that the expansion of the thorax is full and symmetric. Also, when hands move apart with equal distance and at the same time while the patient is letting breathe. Findings in this procedure can detect if there are any abnormalities in patient's breathing. Now, let's proceed to the palpation of tongue-line Prmsu. Sir, can you please recite the word blue moon as I palpate your thorax?
Blue moon. 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 Blue moon.
The result is that the symmetry of the vocal Prmsu is bilateral. Also, the Prmsu is heard most clearly at the apex of the lungs. This procedure tells us if there are any abnormalities of the patient's lungs. Now, let's proceed to the percussion of the anterior thorax. This procedure can detect abnormalities based on the sound produced through percussion. It includes resonant, dullness, stony dullness, and hyperresonant. The result is that the percussion note and the sixth wave are resonant, but are flat on the areas of heavy muscles and bones, dull on the area of heart and liver, which are normal. Now, let's auscultate the patient's trachea. Sir, can you please take deep breaths using your nose as I auscultate?
Yeah, sure.
The result is that the trachea of the patient produces bronchial and tubular breath sounds. This procedure can tell us if there are any diseases in the lungs of the patient. Now, let's proceed to the auscultation of the anterior thorax of the patient. Sir, can you please take deep breaths using your mouth as I auscultate your chest? The result is that the sound of breathing of the patient is vesicular and bronchovesicular sounds, which are the normal sound of breathing. Any problems detected in this procedure can tell us if there are any injuries or diseases in the lungs of the patient. Document the findings in the assessment of the patient.